Okay, where did we stop? Oops. That one. Okay, this one. Fingers. So any questions about your lab exam on Tuesday? Blessing.
It does head flexion, will that be that one? Because I thought it was the leg.
Yeah. Either well, your head is the one that's, but your neck is involved too. Some books call it head flexion. Some call it neck flexion. It just depends on the anatomy textbook. Yeah. Let's start doing. What muscle allows you to do that? Sternocleidomastoid, right? So you're going to have to be able to palpate that muscle. If you tilt your head to the opposite side, ipsilateral, that's a term you need to know if you're pre-nursing, you can actually palpate it right here. It's a strap-like muscle. So if you go from your mastoid process here, okay, and it kind of loops around to this little notch here. So you're going to have to, there's one on the left side and one on the right side. You're going to have to palpate it, or pretty much you're going to have to know where these muscles are. You know, if you just point here, bottom line, you need to know that. Okay? So I think we mentioned all of this right here, the different types of or classifications of what your joints here. We did go into a little bit about your diarthrotic joint, which of course is the most complex of them all. These are your freely movable joints, joints of the elbow, your hip, your knee, your shoulder, your fingers. This is the most complex joint. The rest of the chapter is going to deal with your synovial joints. For two bones are separated by a space called what? A joint what? Cavity. Inside of that joint cavity, you have your synovial fluid, which lubricates your joints. Okay? And then certain professions that need to know them. So you're going to have to know these movements when you leave Lawson and wherever you go, whether you are a kinesiologist, a PT, an OT, a nurse, athletic coaches, fitness trainers. These are the joints that are the most debilitating, leads to the crippling effects of rheumatoid arthritis. So I mentioned synovial fluid. The two most important aspects of your synovial joints is that articular cartilage, because it reduces friction between what? Two bones or two joints, and that synovial fluid, because the synovial fluid actually feeds what? The articular cartilage. Okay? Synovial fluid, which is part of the articular cartilage, if both of those are absent, that's when you're going to have some type of issue with your joints. Synovial fluid is a lubricant. Albumin, which is the white part of the egg, and hyaluronic acid. And it nourishes your what? Your articular cartilage. So it provides oxygen, nutrients, things of that way, of that sort, when you take compression off the joints. And of course, when you put compression on the joints by doing weight-bearing exercises, It's going to remove what? Waste and other what? Debris from what? The joints. So we know what macrophages are, right? Those are your phagocytes, or your big eaters. Look what they do. They're the ones that remove the debris from your what? From your joint cavity. So your joints won't be popping and cracking and doing all of that other stuff that's out of the ordinary. All right? So we talked about the meniscus. Blah, blah. What you guys learn about your kneecap, the meniscus? A torn meniscus. Where's my kneecap? I had it up here. Here it is right here. Where's the meniscus on here? Is it here on the front side or back here? It's right here, right? This crescent shape. Which one is the one that's often most commonly torn? The medial what? Meniscus. You have a medial and what? A lateral what? Meniscus. Okay? Tendons, you need to know. Accessory structures we talked about. We talked about bursa, bursitis. A bursa, of course, is just a fluid-filled sac of synovial what? Fluid. They're adjacent to muscles. Wherever you find a nearby muscle, you're going to find a bursa. Where tendon passes over what? A bone, you're going to find a bursa. And people often get bursitis, which is inflammation of the sac. So I showed you the ulnar bursa here on. So we talked about all of this. We talked about range of motion. You need to know that. And I think we were here, multi-axial joints. Multi-axial joints, there are two of them in the body, your shoulder joint and your hip joint. These multi means they can move through all three planes that we talked about in Chapter 1 or Atlas A, your transverse plane, the frontal plane, as well as the what? Your sagittal what plane. Other joints that we're going to talk about are monoaxial or biaxial, which means they can only move in one or what? Or two planes. The elbow is a biaxial joint. Any biaxial simply meaning you can only go from extension to flexion. You can only do what? Two movements with it, flexion and what? Extension. So here are your classes right here. Let's start with the ball and socket joint. What page are these joints on? 298. I'm in chapter 10. I'm trying to move ahead. So yeah, at 288 they have the text. 298 they have what? Pictures. So they have them all. They have nice pictures for you guys on page 290, and they actually give a description of each one in your textbook, starting on page 288. So there's 6 classes of synovial joints that we're about to look at. I think there are a couple of them on your final exam. This one is pretty easy. I know this one I think is on your final exam. I always put the ball and socket joint on the final exam because it's pretty straightforward. A ball and socket joint, hence just what it says. You're going to have a hemispherical head that's going to fit into what? A socket. It's a ball. This is your ball right here, which is your head. And this is your socket right here, which is your glenoid cavity or your glenoid fossa. So your shoulder joint, there are only 2 ball and socket joints in the body, your shoulder and your hips. Ball, socket. Ball, socket. That's it. Okay? Head of the humerus and the glenoid cavity. You guys know the glenoid cavity because you've had a bone exam, right? So hip joint, which is another one. Here we go. Where's the ball? The head. Where's the socket? The acetabulum. Ball, what? Socket. Only multi-axial joints where? In the body. Can move through all what? 3 planes. If you look on page 289, they're showing you the 3 planes that your shoulder joint can move through. Actually, the humerus is actually moving, which is a part of your shoulder joint. But, you know, your book is a little bit different. This book is a little bit different from the book we've used in the past because it will refer to joints specifically. But I think yours just talks about abduction of the arm, flexion of the arm. The book we had before this would reference joints like abduction of the shoulder joint, flexion of the shoulder joint. You know what I mean? So when you do abduction of the arm, which of course is on here, all right, abduction, your deltoid allows you to do that. You've got to be able to palpate this big old shoulder muscle right here. There are 3 fibers, okay? You have an anterior deltoid, a lateral, and a posterior. So when you're in the gym working out and you're doing these movements here, you're working the one in the middle, the lateral what? Deltoid, okay? That's what shoulder ab what? Abduction. Abduction means you're going to move the arm away. You can also do hip abduction. I tried to group them together, but what you may want to do is take them, look at all the muscles, and try and condense them and group them in a way that's going to help you to understand or remember them. Because like I said, a lot of these muscles are repetitive on here, as you can see. And you don't have to, although I did put a lot of them on here. Ugh, look at this sheet. Because there are over 600 muscles in the body. There are about 600 in the body. You don't have to know that many. If you don't learn those, I'm going to give you a bad grade on your test. All right? So yeah, flexion of the arm, okay? The fiber right here, the anterior fiber, allows you to do that, okay? Flexion. When you do this movement right here, okay, that's flexion. Then of course you have what? Internal what? Rotation, or what? Medial rotation. That's one of the movements that you've got to do. Got the anterior fibers working here too, okay? That allows you to do what? Internal rotation or medial rotation, okay? So those of you that have this, of course, you can just kind of highlight as we go, as I go over them. What was that? Shoulder flexion, which is number 6. Your deltoid, the anterior fibers are used, okay? Yeah, when you medially rotate, right here, the anterior fiber is used. Is that on here? So much on here. Shoulder abduction, which is number 22. The lateral fibers of the deltoid are involved in that, along with the supraspinatus, which is one of your rotator cuff muscles. But hey, just know that it's a rotator cuff muscle. And the other one is what? Is it flexion? Shoulder flexion, abduction, and what? Internal rotation. Yeah, medial rotation of the shoulder. Which is number 39. Yep, medial rotation of the shoulder, the anterior fibers of the deltoid. Another thing you need to remember, which nursing instructors say students don't know, their injection sites. Because you give shots. Don't nurses give shots? Sometimes I'll just go into the doctor's office and say, let me stick myself. That's one of your common sites of injection, the deltoid muscle. Big old butt muscle, big, thick, meaty muscle, the gastrocnemius, and the vastus lateralis. 3 injection sites for what? Of the muscles. Okay? Intramuscular injections. All right, condylar or your ellipsoid joints. You have an oval convex surface on one bone that fits into a shaped depression. The radiocarpal. That's the radius. See, I need a complete radiocarpal. I need a complete arm. What does radiocarpal mean? What 2 bones are articulating? Yep, the radius and what? The carpal bone. It's a biaxial joint, as you can see, because it moves in only what? 2 planes. The metacarpal phalangeal joints. These are, okay, sometimes you're going to see in books MCPs. So whenever you see MCPs, that means metacarpal phalangeal. So if you go to med school or nursing school, you're going to probably see it abbreviated a lot as what? Your MCPs. So in your textbook, the condylar ellipsoid joint, the red part, you see those little red arrows? That's the convex, alternating red arrows, and the little depression is what? The phalanx. So you have the radiocarpal, and they're showing you the metacarpal between your phalanges, which is, I thought I had a hand up here. Yeah. Here's the depression right here. Distal, middle, proximal. Right here at the proximal point right here, you're going to have this little convex depression, the convex area from the metacarpal bones. It's going to fit into that. Okay? That's a joint. People get arthritis between, these are your joints right here. Proximal, middle, that little space there. You see that little joint cavity? And you got what? Distal, middle, what? Proximal. Okay? And then you have your metacarpal phalangeal joints. Metacarpal phalanges to metacarpals with what? Your phalanges. Then you have the radiocarpal. As you can see, it kind of fits over, the radius kind of fits over the scaphoid, kind of like that. Okay? That's what it kind of looks like. All right? So you have your little depression right here, depression in the oval convex surface, which is right here. Radiocarpal. The radius articulates with what? Your carpal what? Bones. Your saddle joint, actually there are two of them. The joint at the base of your thumb is called the trapeziometacarpal. That joint is sometimes referred to as your CMC joint. CMC joint. Okay? Which means it's the carpometacarpal. I remember when I took anatomy, they didn't have trapeziometacarpal. They had CMC, which is a carpometacarpal, which is at the base of the thumb. So just in case you see this or that, it means what? The same thing. There are actually really only two of them that are saddle joints, and it looks like a horse's saddle. If you look in your textbook, one of course is what? Concave, and one is what? Convex. Kind of like the condylar joint. So you have the concave, which is like the front rear of the saddle, and the convex, which is kind of like the left right. So the thumb, where's your thumb? Here's your trapezium right here. Okay, so you've got this surface right here, which is your convex, fitting into what? This little depression right here, which is what? Concave. Trapezium, what? Metacarpal. All right. You have the sternoclavicular joint, which is another one. The sternum articulates with the what? The sternal end of what? The clavicle. Okay. Both bones have an articular surface that is shaped like a saddle, concave in one direction and convex in what? Another. Okay. Biaxial joint, more movable than a condyloid or hinge joint, forming the primate opposable thumb. Uh-oh. One of your synovial joint movements. Who can do thumb opposition? Do thumb opposition. I was about to do it for y'all. Y'all haven't looked at this stuff? Wait, let me turn this off. I always take 2 students at a time so you all can comfort each other. You can't help each other out now. So yeah, you have thumb opposition. There is a muscle called the opponens. What number is that? It's on your study guide. Study synovial joint study hints. What number is thumb opposition? Opposition of the thumb. Number 28. Opponens. Opponens pollicis. The anatomical name for your thumb, of course, is pollicis. Okay? That's why it's called the opponens pollicis, which is a muscle that allows you to do that. To pick up those little fine things like little needles. You know, you have to be able to do what? Thumb opposition. If that muscle is severed or if it's cut or something happens to it, you will not be able to do this movement here. You got it? Opposable thumb. Nice picture too in your textbook. So here they're showing you the saddle joints here between the trapezium, the metacarpal, the sternoclavicular. Gliding joints, those are pretty easy too. Those are just bones that really slide right past each other. Those 8 bones in your wrist, these are gliding joints. The bones in your ankles, those 7 bones, those are what? Gliding joints. And the articular processes of the vertebrae. So the vertebrae sits right on top of each other. And they kind of just slide. You're going to get a slight amount of movement between them. Just a little bit of flexibility. They're going to glide, what? Just a little bit. They're biaxial joints. Although only one joint moves only slightly, the combined action of the many joints in your wrist, your ankle, and your vertebra allows for what? Considerable what? Movement. But like I said, the vertebral column, as I told you guys the other day, gives you a little bit of flexibility, but you're not going to get a whole lot of movement there. And we're going to talk about that. The erector spinae muscle. What number is that? You got to know what you got to tell me where the erector spinae muscles are. Okay, which are your SLIM, S-L-I-M. They're often referred to as your slim muscles. Keeps you from injuring your back. The erector spinae muscles. All right. I think it talks about back injury in chapter 10. Then you have the hinge joint. Often think about a doorknob, the opening and closing of a door, which is considered has a hinge on it. One bone with a convex surface that fits into a concave depression on what? Another bone. The elbow joint, which is the ulna and the humerus. Okay, your fingers, your toes. Now these are monoaxial what? Joints. They move freely in what? One plane. Okay. The ulna and the humerus. Ulna and the humerus. Okay? One bone with that fits into a concave what? Depression. Okay. This is your little depression here, which is called the trochlear notch. This is the trochlea on the humerus, and it goes like that. Okay? That's a hinge joint. Okay? Femur and your tibia. Here are your depressions here. These are called condyles. I don't think these were on your bone exam. I should have put them on there. Your tibia has medial and lateral condyles. These little round knobs right here are your condyles on the femur. You have a medial and a lateral. Condyles meet condyles. Condyles are married to condyles. Okay? And, of course, like I say, you have your finger and your toes. So those are what? Hinged what? Joints. Do they have these on? I don't see that on page. Yeah, they do. Page 290, they're showing you the ulna and the humerus and the articulation between what? The two. Okay? So which way is this bone moving when I do that? Based on what you see on page 290. What movement is this? Flexion of what? The elbow. Yep. Flexion. We're about to go into it. Flexion and extension. That guy on page 292 is doing flexion of the elbow. Your book may say flexion of the arm. I don't know. But it's really the elbow. Okay. Pivot joints. One bone is just going to pivot or spin around the other. One bone has a projection that is held in place by a ring-like ligament. Now we know C1 and C2 is what? A pivot joint. Atlas and what? The axis. There's a transverse ligament wrapped around the dens of what? C2 that will hold it in place, kind of locks it in place in order to allow those bones to what? To pivot. Okay? One, will allow you to say what? Nod your head and saying yes. But C2, which pivots, okay, will allow you to say what? No. The proximal radial ulnar joint allows the radius to rotate during pronation and supination. Synovial joint movement. Okay. Somebody do supination for me. Okay. Pronation. Good. When you're doing supination and pronation, okay, I need show and tell. Supination and pronation, okay, the ulnar is on the little finger side, right? The radius is where? On the thumb side. So when you do this movement, it's like they flip sides, because what happens is this proximal end right here is going to form a little X. The head of the radius kind of spins, like your book calls it, a tire in snow. Okay, around the ulna to allow it to what? To pivot. Okay, there's an annular ligament that allows for that, so it kind of holds it in place. That ligament is pretty thick. It's on page, the elbow joint. Page 301, letter A. There are a lot of ligaments involved in that. You see it? It's right around the head. It looks like tape around the head of what? The radius. Okay? The elbow joint. Okay. Another joint. Someone read that last paragraph under the elbow joint. Page 300.
Another joint occurs in the elbow region, the proximal radial ulnar joint, but it is not involved in a hinge. At this joint, the edge of the disc-like head of the radius fits into the radial notch of the ulna. It is held in place by the annular ligament, which encircles the radial head and is attached to each end to the ulna. The radial head rotates like a wheel against the ulna as if for is pronated or something.
Yeah. Kind of goes like that. The little notch. Yep, and then it kind of pivots like. Because those things be acting up, and I can't. What movement is this when your palms are facing forward? Okay. And I'm going to try it. Okay. Here's the head of the radius, right? You see it pivoting? So up here at the proximal part, you have what? An X that is actually what? Formed. What movement is this? Right here. Like that. What? Okay. This thing is in what? The hand. I went from here. What is this called? Supination, right? Okay, good. Y'all better look at those pictures over the weekend. I'm telling you. Y'all are not off the hook in here. Got it. Uh-oh. So here we go. Those of you that have this, if you have your guide from Blackboard, you may want to start printing those study guides from Blackboard and just bringing them in here with you, just in case something out of the ordinary occurs with me. Okay, we're going to start with vocabulary of movements. Guys, we do these movements every day. So now you're about to put a name with them, an anatomical name. All right? You see where they're used: kinesiology, physiology, physical therapy, and other what? Medical fields. You'll have to know that. Okay? Many are presented in pairs with opposite or contrasting meanings. So what I normally do is, what I'm going to do with you guys, just like with pronation and supination, those are pairs. So I may ask Leslie, okay, Leslie, do pronation and supination of the forearm. You know, I'm going to have her to do both of them. Okay? And then I may say, what muscles are involved? Are those muscles involved? Because with supinator, you have a supinator muscle that allows you to supinate, because there's a muscle involved in every movement that we do. Okay? When you pronate, you have the pronator what? Quadratus, and the pronator what? Teres. There are two of them. Two muscles that allow you to do what? That. All right? But I don't think, Scott, some of those of you that have this sheet with you, thanks for bringing them. Do I need to tell you everything? Pages numbers 37 and 38. They have the muscles, but they're not in bold, but won't help to learn them. You know what I mean? Try and go beyond the call of duty and say, can I get extra points if I name all the muscles? That's the only way you're going to get them. You need to understand your anatomical planes and your directional terms from where? Atlas what? A. Anterior, ventral, posterior, dorsal, medial, lateral, proximal, distal. Does that sound familiar? Okay. Zero position. Okay, guys, the position of a joint when a person is in the standard, this is zero. This is not going to be a trick question. Every joint or limb in your body, of course, is extended. Your shoulders are extended. The elbow is extended. Your wrists are extended. Your fingers, the hips, your legs. That's called the zero position. So if I ask Sakina to do, she's like, elbow flexion and extension. This is what students do. They're like, extension? I'm like, extension. What would you all do? Do elbow flexion. Extension. Exactly. They're like, are you trying to trick me? Why would I do that? That's not a part of my nature. You're already in extension. You just need to go to what? Flexion, right? Because joint movements are described as deviating from what? The zero position or returning to it. Like if I ask you to do hyperextension of your trunk, you're deviating from that zero position because you're going beyond what? Extension, right? So how would you, let's just get this thing started right now. Who knows these movements? Who can come up here and two people at a time, come stand right here. Face the audience. Any two. Everybody's going to end up coming up here, so y'all need to start looking at the pictures. Huh? Yeah. She can't come by herself. Okay, come on. Huh? Okay. Joint movements are described as deviating from the zero position. Okay. I want you to... Why are you scared? Just turn your backs to me. That's why I want y'all's back. Don't look at me, because I don't want to... Are you scared of them or me? Oh, well, you look at me then. I'm glad you're not afraid of me. Okay. Extension of your trunk or the vertebral column.
Extension of my trunk.
Okay. And do hyperextension. Good. So she... range of motion, huh? Limited. So she just deviated from... She went from extension to what? Hyperextension. Is that picture in your textbook? What page? Where? Which page? Okay, good. Kelsey, do extension of your wrist. You want to look at me too? Good. You all make me smile when you look at me. Okay, now you do an extension. Flexion and extension occurs in nearly all diarthrosis. Hyperextension is limited to what? A few. Okay. Can you hyperextend your elbow? You can't do it. You cannot hyperextend your elbow, right? Okay. Why? Yeah, exactly. Remember we were talking about bones the other day and how bones are like one of the factors, the articular surface is one factor that's associated with what? Range of what? Motion. Okay. Can I have two more people up here? Next two people on the row. So I'm going to go back and forth. I'm going to go from here to here. So Willie and Miss Tarver, you two are next. So just kind of get prepared. Ashley, Mr. Washington, Isaiah, come up. So while they're coming up, someone read extension for me. Page 291.
The movement that strains a joint and generally returns a body part to the zero position.
Is that it?
For example, straightening the elbow, wrist, or knee, or returning the arm or thigh back to zero position. In stair climbing, both the hip and knee extend when lifting the body to the next higher step.
Uh-oh. That's a test question. The hip and knee extend when lifting the body to the next higher what step? Hip extension. What muscle is involved in that? When you're walking up those steps, or when you're running up the steps, when you're when you're exercising, you're running up those steps trying to tighten up the gluteus. Oh crap! What did you say? The gluteus maximus? Yeah. The gluteus, that big old thick muscle right there, and it also allows you to, like when you're doing that backward swinging of your leg, your gluteus maximus is working. Also when you do this movement here, it's working. So the gluteus maximus has a lot of movements. The backward swinging of your leg when you're walking, you're working what? The gluteus what? Maximus. Okay, so here we go. Mr. Isaiah. Julius Washington? Oh, sorry. Do flexion of the elbow. Okay. Now what muscle do you think is involved in allowing you to do that? There's a muscle involved in every movement that we do. I'm flexing. Where's the bicep? Palpate it for me. Yep, right here. But the prime mover of elbow flexion is what? Which I put on your study guide. The brachialis. Because you have your brachioradialis, you have your biceps brachii. Bi means two. You have a long head, you have a short head. Okay? And you have what? Your brachialis. You only have to do one of them for me. Everybody's familiar with your biceps. You know what I mean? Everybody, fitness trainers, blah, blah, blah. You're at the gym. The first thing they're going to say, oh, what are we working? Some people are like, I'm like, the biceps. You're working this right here. But the brachialis is really your prime mover. The biceps brachii acts as a synergist to help the brachialis. All right? And do elbow extension. You go from here to where? Here. What muscle do you feel tightening up? Triceps, right? It's because you can feel them contracting when you do it, can't you? So with your triceps, guys, how many heads? Tri means what? Have a long head, a lateral head, and a medial head. Are y'all writing this stuff? Apparently y'all gonna listen to this lecture, because y'all were just looking at me. Okay. I meant her, but since you're here, you can stay. You're next. Okay? So he did flexion, extension of what? The elbow. Someone has already done flexion, extension of the wrist. Kelsey did that. She did hyperextension. Just follow the arrows, guys. Do flexion and extension. Okay, let me just tell you one at a time. Do flexion of your shoulder. I think I did that one earlier for you. Is that flexion? What is she doing? Elevation. She just said, I don't know. What muscle is involved that allows you to do this? Shrug those shoulders. I have no earthly idea. What did you say, Blessing? What muscle? It allows you to do shoulder elevation? Huh? The levator scapula? Scapulae, like an elevator going up. Levator, elevator, scapula. So your scapula is what? Going up. So you have what? She just did shoulder what? Elevation. What other muscle is involved? Or did I just put one? Oh my God, the trapezius. We cannot, the one that's shaped like a trapezoid right here, goes from here all the way up here. Allows you to do that too. That's what they put on that nursing exam. When students get accepted into the nursing program here, they give them an anatomy test where they have to label the muscles and where they are. Uh-oh. Shoulder flexion. This is right. I do shoulder extension. Right. Hyperextension. What is this? Shoulder abduction, right? What muscle is working? Ooh, I can feel it tightening up. Y'all will be exercising for me on Tuesday, so Wednesday when you wake up, you may be a little bit sore, your muscles, okay? Now do hyperextension of the shoulder. Okay, do extension. This is extension, right? Now do hyperextension. Just keep going back. Hyperextension. You do when you're walking, doing that brisk walking. That's what you're doing. You're what? Ooh, what muscle? What muscle? Which fiber is working? I feel it. Well, my muscles are sore anyway. Which fiber? What muscle? I didn't put it on your paper, but you should know. When I'm doing this. Speak now. You're going to have to tell me Tuesday now. What muscle? If you do, because see, y'all might as well do it right now in the audience, because you're going to have to do it while you, because I'm not going to be doing this Tuesday. I'm going to be sitting in this chair right here looking at you guys perform these movements for me. Okay, look at me. She's just got a little bit of allergies going on there. What muscle is working? The what? Where's the, okay, now where's the anterior deltoid? So why would this be working? Think. Put on your thinking caps, people. I heard somebody say it. Miss Patterson? Posterior what? Oh, you'll know them Tuesday, right? Because this is what y'all going to be looking at over the weekend. Voila! Surprise! Thank you. Thank you. of your knee? What muscles are working that allows you to do that? You can feel them tightening up. Extend hard now. Your quadriceps. Palpate your quadriceps. Right here, right? Quads means what? 4. Who can name the 4? They're on your study guide. I know all of you guys are going to go beyond the call of duty on Tuesday by naming all these muscles for me, even though you'd only have to palpate the ones that are in bold. What are your 4 quads? Quads means what? 4. Rectus femoris, vastus lateralis, which is one of your injection sites. Nurses, pre-nursing majors, they stick babies there. Okay? Where else? Vastus medialis. Vastus what? Intermedius, right? All of them. They're grouped together. In chapter 10, they allow you to what? To extend your knee. Now the rectus femoris, remember the rectus femoris? I told you guys about it the other day. Who remembers what I told you about the rectus femoris? Because it has an additional action. Y'all didn't listen to my lecture. I may give y'all a quiz on this when you come in here Tuesday. Okay, let's go to chapter 10, and then we've got, I think 202 is trying to come in. Let's find because I may just bypass chapter 10, because all the muscles I'm talking about in chapter 9. Okay, let's find the quadriceps, page 363. So, they have tables throughout chapter 10, guys, because they have those muscles that are grouped together. They have them grouped because they pretty much perform the same actions, which makes it easier to learn them. So if you look at your quadriceps, you see them, right? What's the number one action that you see for your quadriceps femoris, the rectus femoris, the vastus lateralis, and your vastus medialis, and your vastus intermedius? Extends the knee. They all 4 do the what? The same thing. What about the rectus femoris? What else does it do? Yeah. On the hip, if thigh is what? Fixed. Like when you're sitting in your bed reading, that's what it does. The rectus femoris contracts. When you're running, and remember that airborne that keeps you in the air, the rectus femoris contracts, allowing you to what? To do that. When you're doing high kicks, look, high kicks, the rectus femoris allows you to what? To do that. Right, Kelsey Corder? Okay, she's just texting away. Okay. So we're going to finish this up on Tuesday right before your lab. Well, I don't know. I may not. I may just have y'all just, well, you're going to know it Tuesday anyway, so. If you have questions, you can come by my office. Yeah. Wait a minute. You know what? Okay. I'll give it to you Tuesday. Your exam, I'm gonna give you guys a take-home exam Tuesday. Yeah. If you're not here, don't come by my office. I told you it's not over until it's over. So you can skip if you want to. You're gonna have a 0 on Blackboard.